Hi, I'm Jennifer Stelfox, Doctor of Veterinary Medicine and Certified Canine Rehabilitation Therapist. The exercise I'll be demonstrating today is a passive exercise called PROM, which stands for Passive Range of Motion. PROM involves moving the joints through their full range of motion without any muscle contractions required by the pet. The pet simply lies there while the handler gently extends and flexes the joints. PROM has many benefits, and these include increased blood flow and lymphatic drainage, which decrease joint stiffness. PROM is indicated for pets that have decreased mobility, and they are also good for our arthritic pets. They increase the strength of muscles and tendons. Cold muscles and joints don't move very well, so it's important to warm them up prior to any PROM exercise. Take your pet out for a 3 to 4 minute walk, massage the muscles, or apply heat. Starting at the lower extremities, we move the toes by flexing and extending them passively. Notice that Amy is not moving her joints. I am the one extending and flexing them. Now we move up to the hock. With one hand, I stabilize the leg above the joint, and with the other hand, I gently begin to flex and extend the hock to the point of resistance. Increased resistance may be caused by arthritis, joint swelling, or tight muscles, and it may take several PROM sessions for tight joints and muscles to relax. So when you feel tightness, do not flex or extend the joint any further. Instead, hold the joint at this small level of resistance for 5 to 10 seconds, then relax. Repeat 8 to 9 more times. Then we're on to the knee. It is important during PROM exercises to isolate the joint that you are working on and try not to move the other joints. So in order to isolate the knee joint, I support the upper thigh with one hand, and I hold the lower leg immediately below the knee with my other hand. This keeps the rest of the leg in a neutral position. I then begin to first extend her knee and then flex it. Notice I do not force the limb beyond what is comfortable for Amy. Knee joints are particularly prone to problems. Small dogs frequently have overly mobile kneecaps, and large dogs are prone to rupturing their knee ligaments. Both of these lead to instability and arthritis, so it's important to keep our knee joints strong. Now comes the hip. I pull the leg forward to flex the hip joint and then move the leg backwards to extend the hip joint. As I flex the hip joint, I stretch the gluteal muscles, and as I extend the hip joint, I stretch the hip flexor muscles. Dogs with hip arthritis may have difficulty during hip extension, so remember to respect your pet's limitations and only extend to the point of resistance. Now we move on to the front legs. The toes are flexed the same as the back legs. To bend the wrist, we first stabilize the wrist, and then we flex the paw upwards towards the back of the leg. A healthy wrist will allow the pads of the feet to almost touch the back of the leg when the wrist is flexed. Pets with wrist arthritis will have limited flexion. We then fully extend the wrist. Now we move up to the elbow. Amy has elbow arthritis and is very limited in motion here. Again, I am careful to only flex and extend the elbow to what Amy will tolerate, and this is where I hold the elbow for 5 to 10 seconds. Notice that I keep my motions small. Now let's move up to the shoulder. Here we will flex it back and then extend it forward. This time, Amy allows me to do these motions easier as her shoulder joint is fairly healthy. Ideally, we would perform 10 or so repetitions on each joint and on all 4 limbs. Passive exercises can also be performed on cats, but it's often easier if you have an assistant to gently stroke and hold on to the cat as you perform all the same exercises that you do on their canine counterparts. The process is the same with all joints being extended and flexed to their comfortable limit. With lots of praise and the occasional treat, it'll help your pet to look forward to their PROM exercise sessions. It won't take long before you notice their increased mobility and them moving better when they go out for a walk. I want to encourage you to work with your veterinary team to help your pet become the best it can be. Thanks for watching.